education is a lifelong learning process and is something that we do every day, and there's not a day that I don't come to work that I don't learn something new that's of great value. And so the Educational Services Department, the role that we play in that is that we participate in making sure that the staff receive updated educational information on new best practice, on regulatory agency safety requirements. It could be on a new piece of equipment, it could be on new technology. So we cover a large variety of different types of educational needs, and we feel that that is the foundation for developing a stronger workforce here at Southeastern Regional Medical Center. And we have a very supportive executive leadership that values the importance of continuing education and ensuring that we have a strong workforce that is highly qualified to provide excellent care for our patients here. The Educational Services Department here at SRMC, we are a liaison that provide American Heart Association classes, and we're a community training center designated. So therefore we can provide cardiopulmonary resuscitation training, which is our CPR, heart saver, AED classes, first aid classes, advanced cardiac life support, advanced pediatric life support classes. We also provide computer training, leadership excellence classes to promote and build the leadership skills of our staff. And we also recently began providing a end-of-life care class as well. So as I say, we have educators with a vast amount of experience, and we provide a lot of continuing education training in various topics that we feel is important and needed not only for our hospital internally, but also for our community as a whole. We want our patients to receive excellent care. In order to receive excellent care, you have to have employees that are highly qualified to perform the various skills that may be needed. And so through our continuing education, our updates, our American Heart Association classes that we provide, this improves our ability to provide excellent care to our patients. And so that's what our whole goal is focused around, because our patients, that's what we're here for. And so it's very important that we have a highly qualified trained staff to do the work that's needed. We have continuing medical education credits that we provide, and that's in conjunction with Southern Regional AHEC, and they provide those continuing credit hours for us. They also assist in obtaining speakers who are very knowledgeable in various topics that we can provide those topics here for our physicians, for our hospitalists, for our nurses that are on staff, and any other discipline, pharmacists or respiratory therapists that may attend those classes as well. Continuing education credits, that's important for two reasons. First of all, it is required for certain disciplines, physicians, pharmacists, nurses, to acquire a certain number of continuing education credits annually, twice a year. And so basically they are going to seek out those types of courses that will provide those credits. Secondly, there's information literature that says, continuing education is extremely important. It helps that professional maintain their knowledge base. They are able to keep up with current best practice, and that's exactly what we want, because healthcare is just constantly changing. And there's new technology, new information that's on the rise, and we want to make sure that through continuing education that our professionals have access to that information at their fingertips so that they can utilize that to take better care of our patients here. We have a very good relationship with 7 schools where the students complete their clinical rotation here at Southeastern Regional Medical Center, and we have a very strong relationship with one of the universities that's right here on site, our campus, which is the University of North Carolina at Pembroke. And many of the students are familiar with our organization. They have completed mentorship training programs here. They've conducted their clinical rotation here, so we have a really very strong relationship built. Once those individuals are selected and they're hired, they go through the human resource orientation, then to our department, which is the Educational Services Department, to complete their new grad orientation. The University of North Carolina at Pembroke, they have a simulation lab, and in that simulation lab they have mannequins. The staff, they're able to utilize the equipment that can simulate activities that actually happen in a patient's room. And actually we utilized our lab this past fall, and we had a catheterization class in which the staff was able to participate in simulating how to insert a catheter using sterile technique. So that's just one example of how the simulation lab can be used. Other examples of collaboration with other facilities to help facilitate our education programs here at SRMC include our collaboration with Duke University Health Systems. They work with us annually in providing the nurse trauma core course that's provided here on site at SRMC, and their speakers come down and participate in teaching those classes. We've also worked with Chapel Hill with their burn center and providing classes, burn classes here on site as well. And we also work with Roberts Community College in providing the critical care symposium there at their school. And so we have some really great collaboration that's going on within the county and with other hospitals outside the county as well. So we're very pleased with that. We have the American Heart Association Health Saver First Aid, and we have our CPR. We have a version called Family and Friends CPR. And many of the educators participate in teaching that at various churches out in the community. Also, the community can come in to take our CPR classes, our first aid classes. We've offered Spanish classes in the past and hope to do more of those in the future. We have also added a end-of-life care course for individuals who may be providing care for loved ones who may have a chronic condition. We also provide registration for young expectant mothers who would like to attend the maternal child health childbearing preparation classes here at Southeastern Regional Medical Center. Many of our classes do not require a fee. There are some classes that do require a fee, and basically is to pay for supplies or books or some items that may be needed to support the implementation of the particular class. But there are a lot of classes that are available to the community that we do not charge a fee for. To find out more about available classes offered here through the Educational Services Department, you may call 910-671-5011, and we'll be glad to assist you in helping with providing any information or answering any questions that you may have about our educational programs.